Welcome to this presentation by the Medical Informatics Initiative in Germany. My name is Ian Green. I'm the Customer Relations Lead for Europe and Clinical Engagement Manager for SNOMED International. Today's speakers are Mr. Sebastian Semler and Professors Thomas Ganslandt and Ulrich. And with that, I'll hand over to Sebastian.
Thanks, Ian, for the introduction, and welcome to our presentation. Thomas Ganslandt, Ulrich and me would like to present to you the information about the German Medical Informatics Initiative, which is the background for the first steps in the introduction of SnomedCT in Germany. I'd like to give us an overview about our presentation. At first, we start with some information about the Medical Informatics Initiative. Then we talk a little bit about interoperability, about data sharing, and a special idea we have in Germany to define a core data set. Then we come to the introduction of SnomedCT in Germany and the National Release Center. And then we will give you a slight overview about the usage of SnomedCT in the context of the Medical Informatics Initiative in Germany, and we will end with a short outlook. The next thing is the Medical Informatics Initiative. This is an initiative created and funded by the Federal Ministry of Education and Research in Germany. It's composed of 3 funding phases, or just over a decade, from 2016 until 2026. And in the current phase, we have a 160 million euro funding. And all of the 36 university hospital sites in Germany participate in this initiative. And we have a central coordination project and a central coordination office, which is run by the Association of the University Hospitals and the TMF, which I'm presenting here. The idea and the aims of the Medical Informatics Initiative are to improve research opportunities and patient care through innovative IT solutions, and especially to intensify the exchange and sharing of data between institutions, and especially to make available data from the healthcare delivery system to research. And this is one big issue in Germany because of the different stakeholders and the different responsibilities we have in Germany in this field. And the third big aim is that we want to position the medical informatics as a progressive field in research, teaching, and education. The final idea of it is that we want to build up a learning health system by making available experience data from the patient treatment to research, and that we want to give in a shorter time and in a better way the results of research back to the patient treatment in Germany. This is the structure of the Medical Informatics Initiative. We have 4 consortia in Germany where the university hospitals take part. They have slightly different scientific purposes, and we are building up together a big platform and a big network in Germany, all over all university hospital sites. The 4 consortia are the DI Future Consortium, the Miracum Consortium, the HIMED Consortium, and the Smith Consortium. And you see on the right side the localizations of the university hospitals taking part, with a lot of partners from academia and from industry within these consortia. One crucial element is that there will be built up so-called data integration centers at each of the university hospitals, which are dealing the preparation and gathering of the data from the primary care systems. This is once again the list of the consortia and the participants, and you can see that we have a lot of participants all over Germany within this initiative. This is the project structure. We have a national steering committee where all of the 4 consortia and the coordination office participate, and the federal ministry is always present there, and we have a very intensive dialogue between all the partners and with the ministry. And we have a very intensive working in different working groups where the experts from all of the university hospitals take part. We have a working group on the matters of consenting the patients to giving their data to the data structures. We have a working group about data sharing, a working group which is dealing with all matters of interoperability, and also very important a working group which deals with everything concerning communications to the public and to the patients and to the politics. This shows a little bit more how much work is to be done. You see the same structure as in the slide before, the National Steering Committee and the different working groups, but there are a lot of sub-projects and task force already running. So we have a lot of work to be done by all the experts from the university hospitals. I already mentioned that the project is designed in 3 phases. We had a conceptual phase in the beginning, and then 2 major phases, and we are just in the middle of the second phase, the so-called development and networking phase. We have some supplementary fundings. We already started 2 so-called overarching use cases in which all of the 4 consortia take part. And we have the support activity, which means the coordinations project, which is supporting the work done by the 4 consortia and their participants. What is the aim of the different phases? The first thing is clear. The conceptual phase was the idea that we build up a common concept, which is still the background for all of the initiative. And at the moment, in this phase, the development and networking phase, we are building up the data integration centers at the university hospital sites. We have a lot of activities in strengthening research and teaching and further education, and we are dealing and building up the interoperability matters, which Thomas Ganslandt will soon explain more in detail. And this is the basic idea. We want to make available the routine healthcare data for research projects, so we extract them from the primary IT systems in the hospitals, the hospital information systems and similar IT systems to the data integration centers. And then we extract the common core structure of the data and make them available for research projects in a pseudonymized way. And the basic idea, I think that Thomas Ganslandt and Ulrich will come to this again, is that at the end we have a central access point where research scientists can get harmonized data from all of the university hospitals, while the data stay within the walls of the hospitals. And this is very important. We don't build up a central database, but we have a cascading systems with decentralized data storage. Within the first years, we had some major successes. We pushed very much the usage of LOINC in Germany. Thomas Ganslandt will just go more into detail this. Also, we took a lot of efforts into patient participation. We have dialogue formats established. We have in the interoperability field the first HL7 balloting running, and we achieved a major achievement in Germany. We have a common broad consent template, which is accepted by the other data protection authorities in Germany. And finally, we introduced SnomedCT, which is the topic of today. and I hand over to Thomas Ganslandt.
Yeah, thank you very much, Sebastian. In my part of the presentation, I'd like to focus on the implementation, but also the challenges of data sharing and establishing a core data set in the Medical Informatics Initiative. And let's look at this process of making data available for research. And maybe starting to look at it from the back, we can, of course, state that we need structured clinical data sets in order to carry out this kind of research. And especially looking at applications for machine learning, for instance, we need large collectives. So this is data that is not going to be sufficient to take from just one site, but rather from multiple sites. We're looking at large data sets. And keeping in mind that we are now collaborating across maybe several or all of the German university hospitals, we need a governance structure that will allow to decide which data use requests are going to proceed and which ones need to be defined better or maybe even stopped. And also a prerequisite that we need to fulfill, of course, is to have a legal foundation in order to use the patient data. And while there are several use cases where data can be analyzed in an anonymous and aggregated fashion based on research exemptions in the data protection legislation, for more advanced use cases, especially for enrolling patients in studies using biosamples, we would need as well explicit informed patient consent. And that brings us back to the actual situation where this data comes into life, the capture of routine clinical data in the routine hospital IT departments. And along this pathway, of course, there are several challenges that we face. And the first one of which is, of course, how can we actually achieve harmonized data structures across this very heterogeneous collection of university hospitals and later on even non-university, non-academic hospitals. Then combining those next two steps, how can we define consistent consent, especially broad consent that leaves open for which purposes the data is finally then used, and also establish harmonized governance policies across all of the different players that are participating in the platform. And how can we objectively measure and optimize the data quality across this sometimes heterogeneous and not recorded for science, but rather for billing and treatment purposes data sets? And then finally, also, how can we securely implement this kind of data sharing while maintaining privacy of the patients and also data ownership at the respective sites? And as Sebastian mentioned in his slides, already the way that we address these challenges in the Medical Informatics Initiative is collaboratively through the working groups and task forces that have been defined and set up in the Medical Informatics Initiative. And as mentioned, we've got the interoperability working group, which is chaired by Uli Sachs and me. We've got the consent working group as well as the data sharing working group and the communication working group, which is not mentioned on this slide because it's not directly involved in the technical implementation of data sharing. So a main output from the consent working group is the modular consent template that I'm going to describe in a little bit more detail in the next slide. And the data sharing working group has established, on the one hand, harmonized policies and contracts that can be used to govern access both locally at the site, but also between the data requesters and the participating sites that provide that data. And that working group has also established a harmonized data sharing process that helps us actually implement and govern and quality manage this process of sharing and providing data. And the interoperability working group is, on the one hand, defining data structures, interfaces, terminologies in the form of the modular MII core dataset. That's also going to be described in a bit more detail later. But on the other hand, it also takes up the work from the other working groups and provides concrete definitions and specifications for their implementation at the participating consortia and participating sites. For instance, in a specific way to implement the modular consent in such a way that it can actually be captured electronically and processed during data sharing. Also, the interoperability working group is providing ways to annotate data quality and provenance next to the actual data sets that are being provided. And finally, it's also preparing specifications on how to implement federated data analysis platforms where the data can actually stay at the providing sites, and aggregated results of those data analyses can be passed back to the data requesters. But let's take a look at the outputs of the consent and governance processes. There's, of course, the modular broad consent template that was already mentioned by Sebastian in the first part of the talk, which includes both a general introduction to inform patients about the different kinds of use, types of use that data can be put to in the future, as well as a secondary part where the actual patient consent can be documented, which also allows in a very differentiated and modular way for patients to choose which types of use they would actually consent to. And this is accompanied by a legal guidance document that will assist the hospitals in actually implementing this both from a legal as well as from a technical perspective. And I think as a very positive and large accomplishment that we achieved here is that we got this approved in a very lengthy and detailed process, but in a positive process with all of the German ethics committees as well as the Conference of the German Data Protection Officers. So I think this is a first in the sense that it covers both biospecimens as well as the use of clinical routine data for scientific purposes in a generic way. Then we've got patient information materials that accompany it in order to empower patients also to understand what kind of uses are being, their data could be put to in the future. And as I mentioned, the structured consent representation. Then from the data sharing working group, we've got these data sharing process models, which are annotated in the business process markup notation, and which can be used to represent these different steps of requesting data, approving these requests, and then actually preparing and providing the data on different levels of detail. And accompanying this and based on it is both a harmonized data use policy, which is currently being rolled out across the German university hospitals participating in the MII, as well as a harmonized data use contract, which is currently being finalized, and that will greatly simplify to pull off data use projects across a larger number of university hospitals. Okay, let's switch now to the MRI modular core data set. Of course, the most important central piece of the data integration centers and their ability to collaborate across the different participating sites is to have a shared representation of that the data which is captured, of course, in diverse systems and diverse situations can be converted to so they can be analyzed in a harmonized way. And the way that we approached this in the Medical Informatics Initiative was to define first a set of basic modules, which are mandatory actually for all of the participating hospitals, and a secondary set of expansion modules, which are only relevant if the respective use cases of the sites, also the source data is available at the sites. And these basic modules, they are consisting mostly of billing data actually, which are readily available in a structured fashion at all of the German university hospitals, but as well of lab findings and medications. And all of these modules are either already finalized or are currently in the process of being finalized and put into production use, whereas the extension modules are currently still in the process of definition and will be added going forward. We have relied on existing and established standards when we designed and are continuing to design our core dataset modules, and the main technology that we are referring to here is HL7 FHIR, the Fast Healthcare Interoperability Resources, which are the foundation of almost all of the modules, unless there are other established standards, like for instance DICOM for medical images. And a very important key aspect of these modules, of course, is that we need to semantically annotate the items, also value sets, and different aspects of those modules. And we are trying to use as much as possible established international terminologies, like, for instance, LOINC for most of the laboratory module, but especially, of course, SnomedCT for all of the modules, but as well also for the lab module, for instance, in the context of microbiology, germ identification. We are designing these modules in a collaborative fashion using publicly available front ends like Art Decor from the HL7 community or Simplifier to define the profiles. And we're doing this as part of a very much open governance process that includes also a public balloting step. So the public and the community is very much invited to participate and make sure that this actually is an implementation that is not just used in an isolated fashion in the MII, but also from the vendor community, also the user community. And of course, this list of modules, it's not finished. It's going to be extended over time as additional things become necessary. Okay, so let's continue on. This is just a screenshot from the Simplifier front end that shows how the actual definition of these modules look like. Can see that different terminologies can also be used, like for instance ATC or Pharmazentralnummer to classify medication in this specific context. On this slide, there's a brief description of how a site would go about actually converting the data into the MRI core dataset format, first gaining access to it from the source systems, then extracting and integrating that in a shared database, then as a next step, harmonizing it semantically by annotating the items and value sets using terminologies like LOINC or SNOMED-CT, and then transforming it into a harmonized data structure like, for instance, HL7 FHIR for most of the modules, which would then allow cross-site collaborative analyses of these data items. Yeah, which brings me to the last slide. Which shows that, of course, these modules are not just standing next to each other, but they actually interact in the sense that for specific use cases, we can then bundle data elements from these various modules that have been defined in the core data set in order to then bundle together a data set that fits the requirements of that specific use case, as those use cases are listed here from the Medical Informatics Initiative Consortium. Yeah, and with that, I'd like to pass the microphone on to Sebastian again for the third part of the presentation.
Thanks, and I'd like to continue with the introduction of SnomedCT in Germany. And we have a long story and history talking about SnomedCT in Germany. We started in 2006 when the German Medical Informatics Association wrote a position paper and recommended to deal with and to introduce and use SnomedCT in the medical documentation in Germany. And in 2007 from TMF we had an expert workshop and a recommendation to use it in the medical research field. So long we have strong supporters and experts who want to use SnomedCT in Germany. And then things were getting slow, and we had a lot of commissions and projects, strategy projects also for the Federal Ministry of Health, which strongly recommend the use of SnomedCT in Germany. And many of the experts know the projects on the European level, like EPSOS and AssessCT, who also recommended the use of SnomedCT not only in European projects, but also on the national level. And this was the situation when the Medical Informatics Initiative started. The National Steering Committee of the Medical Informatics Initiative announced very early that they could not deliver this interoperability purposes and the idea of the harmonized, standardized core data set that Thomas Ganslandt just described without SnomedCT. And so we started together with the Federal Ministry of Research in the beginning of 2017, the negotiations with SNOMED International, and finally we had a license agreement, and we could start with SnomedCT at the beginning of this year. And this was and is funded by the German Federal Ministry of Research as a part of the supplementary funding modules in the funding scheme of the Medical Informatics Initiatives. And this is the situation. We have SnomedCT now available since mid of March this year, and the legal basis is a special license agreement between SNOMED International and the Federal Ministry of Research. It defines a pilot phase and a pilot license, which is limited for 3 years, and the license is available for nationwide all participants of the Medical Informatics Initiatives and their partners from the academic field as well as from the industrial field. And we built up a national release center, and for this pilot phase, this is situated at the TMF. On the right side, you see the press conference we had in March this year together with SNOMED International, and we are very happy to execute this step. And this is the pilot license and the ideas we follow in a glance. And so I come to the National Release Center. How do we work at the moment with SnomedCT, the National Release Center? You see on the right side our little team, which is doing the work for the National Release Center. We are doing the license management. We also executed and arranged some training measures. We have a very intensive and very constructive communication with SNOMED International, and we are the contact person for the users. And also, we are very happy that SNOMED International started some experts communication and also translation work, where we have a little a delegation of experts from the Medical Informatics Initiative working in this field together with the partners within SNOMED International. These are the tasks of the National Release Center in a nutshell, and we are very happy that we have this way SnomedCT in Germany available, and we are currently building up competences in using SnomedCT in the documentation and the data annotation, and also in the research projects. Ulrich will just go more into detail with this. And I just mentioned that SNOMED International has some expert communication, and we are very happy that there is a German translation group initiated by SNOMED International, and we are very happy to with our little delegate team being part of this initiative together with the colleagues from Austria, Switzerland, and Luxembourg. And we just started the translation process according to the use cases and the needs in the field, as well in the patient care area, but also in the medical research area. At the moment, we have a lot of licenses given into the field. And you see the different usage types. We have academic development usage of our SNOMED licenses in Germany, educational aspects, healthcare providers who uses this license within this pilot phase, and the most part is the academic research partners, but also commercial partners within the Medical Informatics Initiative are already using the license from the Medical Informatics Initiative. And for some insights into the first steps of usage of SnomedCT, I hand over to Ulrich.
Yeah, thank you. So I'm going to touch up a little bit on the usage of SnomedCT in the context of the MRI. So how does it feel to use SnomedCT? We saw this in Thomas' slide deck before. So we're looking into the upper lab result corner for now, as we already told, because there's an urgent need of using SnomedCT, despite that LOINC fits very well in there. So what we see in a lot of discussions is that SnomedCT is quite complex for the direct application in the use cases. So the models are scared to learn another terminology, another complex system. The information models are too complex for direct use. So our strategy is to hide the annotation. So we have a hidden annotation of the model elements and the value sets, which works out pretty well. But the challenge is that both the domain experts and the model experts have to work together in order to produce a valid annotation. So this has to be in close dialogue with the modelers and the domain experts. We came up with a iterative approach, and you heavily use the HL7 balloting mechanisms, as you saw the tools before. It works out pretty well. And of course, the German translation is very important in order to get even more acceptance. But this seems to be working pretty well with the hidden strategy. And what we see is driven and approved by use cases. Above all, of course, the COVID-19 use cases. We're heavily involved in the Medical Informatics Initiative, of course. I will show you one example. One result is the Gecko Plus dataset, which is already annotated with SnomedCT terms. And another example from the Smart Infection Control Systems in Lübeck campus. So that's what I picked. First example, German Corona Consensus dataset on COVID-19. Those data elements are derived from the Medical Informatics Initiative core dataset, and they're enriched for COVID-19. The sectional cut didn't fit perfectly between the basic modules and the extension modules, but we were flexible enough in our iterative approach to take account of that. So the data elements are modeled and documented in ArcDecor and the simplifier. Same tools like in the Medical Informatics Initiative, and it seems to be absolutely necessary to have a transparent tool where everybody can look what's modeled, which terminology is being used, and how are the value sets. So this is, I think, pretty successful. I show you the link a little bit later. The German consensus data set on COVID-19 already uses, for the 81 data elements, 46 are already annotated in SnomedCT and validated with the domain experts. So this was, the web conferences in the evening where everybody is fighting for the correct terms, and then it's in there. And it's as well for the data elements, for the items, as well as for the value sets. Other data elements, mostly the lab results, are annotated with long terms. And as you saw, we have a long history on using long terms already. So this is the link. Of course, you cannot really read everything on there. You see the different iterations. The first iteration was a very small and slim data set on COVID-19. But of course, people liked it and it extended it. So there's several extension data sets right now, but it's all transparent in this nice system with a tree-like view. Show it on the next slide. So on the left-hand side, you see the different groups, and people like it a lot, and the domain experts like it a lot, because you just can click on the demographics, on diagnosis, on lab results, and you see in the tree next to it what's being coded already. Here you see one unfolded tree, and here you see the little bit bigger that you see, for example, for the major diagnosis, the concepts are listed here, and translation is not the big issue because you see SnomedCT helps a lot. Here's the ICD-10 code, and it's all annotated with SNOMED terms in HL7 style. Here you see the OID, SNOMED clinical terms. This helps a lot as well because this is internationally usable and no German special solution. That's very important. Second example is one from the Lübeck campus. Lübeck is involved in the HIMATE projects, one of the 4 projects in the Medical Informatics Initiative. As you see, this is not a mistake. So those guys work with SnomedCT since 2006, even if the license just came right now. So this was research on SnomedCT referenced terminology. So it's not completely new in Germany, but still we're disseminating and training the people. This is very important to train people. The example shows here the coding system for SnomedCT. So you got some terms, some parents and child is what we like a lot. Those hierarchies we actually could put in there. On the other side, there's a concept map, SnomedCT on ICD-10. There's a translation in there. And one thing we personally need for validating those translations is the something like a validation code and the proof that this was validated by the concept, by the domain experts. That's, I think, a very nice example. Published here in, I think it's in English, so this link should work, by our colleagues Cora Trenkran and Josef Ingener from Lübeck. So this is the important box, just noted here. So they focus on the use case infection control in the IMID project. So this was very timely, though initially with infection control we thought about different things than COVID-19 because there's more infections going on. You have to follow up. The SMIC systems, smart infection control systems, will be used to prevent infection chains, dealing a lot with ICUs. And uses the patient ADT, the admission, discharge, and transfer data in order to follow up. The important thing we came upon was that for following up the microbiology results, that LOINC wouldn't be enough. So we like LOINC a lot for clinical chemistry, but there was the urgent need to annotate the microbiology terms. And there, of course, SnomedCT is perfect because the concepts are there, and there was a huge mapping effort going on, and it's still under review right now. The first terms can be used, and of course, they need a FHIR terminology server, so we're using Onto server there, and we'll set up to query for SnomedCT contents in there. So SnomedCT in the wild, I wrote over there because yeah, something is hidden more or less, but it's very useful here. So we use it for the coordinated list of about 700 pathogens being mapped at the different locations. It can be even mapped to the local data set because people are doing different analysis in the different labs. And the Lübeck guys, when they use the SnomedCT's expression constraint language, that's what we are very interested in the interoperability working group to learn where we can need it, for example, for bacteria and fungi. So this is far beyond COVID-19, but again, COVID-19 was here a accelerator and showing what works and what doesn't work. So we're using the FHIR-based terminology server Onto server here in the Lübeck project. And you can read more about it in this publication I wrote down here. And the information model includes LOINC, ICD-10, ATC, as you saw it, but SnomedCT is used. So here's the example. For example, in LOINC, you could put in there bacteria identified in unspecified specimen by culture. Nice. So you get your code, but it's not what you want. So what you want is more like this. This code. Clostridioides difficile organism, so you can drill down and describe exactly what you find, and this is very important not only for COVID-19 but also for other infection terms. Here I put out, unfortunately a little bit small, something about Salmonella. So those are all the different Salmonella types. It's one LOINC term again, and so many different flavored SnomedCT terms. So 720 items in this little microbiology example. So for some terms, there was no SnomedCT terms for 6 major pathogens. So they're reaching out for the SnomedCT community in order to fix that. We urgently need more domain experts who are willing to give their domain expertise into the modeling and into the mapping, because we saw we need this validation of the mapping from one term to the other term. And we do a lot of tandem teams in the project with data scientists, microbiologists, and medical doctors. So it's more trios, more or less. But those people have to talk, and therefore we need nice tools that people can talk and validate things in there. So 2 little examples out of the huge world of the medical integration centers. Here you see we just talked about exactly this one in the high north of Germany, You see there are so many more data integration centers, and the effort we're doing in this interoperability working group and in this SnomedCT governance is that those people exchange their concepts, exchange their results. Maybe they exchange what doesn't work in order to get a central services up and running for the German community and beyond. So far from a little example. So now Sebastian has to take over.
Okay, thanks, Ulrich. At the end, we like to give a short outlook about the perspectives we have with SnomedCT in Germany. I already showed this slide, and on the right side you see some current developments. Just these days, we will have a new law in Germany coming to force, and things are really speeding up at the moment. With this law, there will be the decision fixed that Germany will be a member of SNOMED International beginning with the next year, and that our Federal Institute for Drugs and Medical Devices will take over the responsibility for the SNOMED CT usage in Germany. So we will have a strong impulse on the usage of SNOMED CT not only in the medical research field but also in the patient care area, and much more impulse is given by the situation that we just in Germany are building up the electronic health records in Germany, and we have a responsibility by our National Association of Statutory Health Insurance Physicians, the KBV, which is responsible for defining the content of this electronic patient records, and they're defining so-called medical information objects, which are standardized documentation sets, which will be in this electronic patient record, this national electronic patient record. And we are very happy that we have a collaboration, a very close cooperation between the Medical Informatics Initiative and the KBV in doing this. So we achieve that we use already existing definitions we built up in the core data set of the Medical Informatics Initiative for these medical information objects, and the other way around. So medical care and medical research are going closely together using the same definitions and the same standards at the moment. And here you see an example. One of these medical information objects is the vaccination certificates, and there you have definitions which are using SnomedCT and HL7 Fire, and which are standardized and harmonized between the partners in the medical care and the medical research fields. Other objects are, for instance, the maternity pass and some more. I don't go into details. One last thing, very important, is that we already have a strong impulse on the current patient care situation and also the research initiatives concerning the coronavirus. And we are very happy to see that SnomedCT is already used nationwide within the GECKO data set, which is the data set building the core structure for the nationwide research network about COVID-19. So at the end, we see that things are really speeding up. We are very happy and we are pleased to have made such a quick start in Germany with SnomedCT, and we are confident that with the help of and with using SnomedCT, we will achieve standardized documentation harmonized between patient care and medical research. So thanks, and yeah, we are happy about questions.
So I'd just like to thank all the presenters. We're now going to move from the recording onto live QA. So thank you. Hello and welcome to this live Q&A session. My name is Ian Green from SNOMED International, And first of all, I'd like to thank our presenters, so Sebastian Semler and Professors Ganslandt and Stats, for their very impressive presentation on the exciting developments in Germany. So some of you have already added some questions into the Q&A box. If there are any other questions, please add them as we're talking. So the first question, one of the tasks of an NEC is to communicate with fellow NRCs. Are you looking to address this in the pilot phase? So I'm guessing that's for Sebastian.
Yeah, thank you. Thank you for the question. We have contact with other NRCs within the German language translation group, which has been established by SNOMED International. That's at the moment the only communication process we have with other NRCs. A second process can be started and can be very useful, I think, at the end of the year, when we have the first user feedbacks and a little bit of overview about use and problems with the use of SnomedCT within our community getting the licenses from us. But I think at the moment we have only the communication process within the translation group.
Thank you. And the next question from Xavier, are you using or implementing the International Patient Summary as part of the MII project?
Yeah, I think I can take that question. So thank you for that question as well. It's very relevant. And in fact, we are using the International Patient Summary as a template that we have incorporated into the MII core dataset modules. However, in several cases, we would, of course, we needed to adapt the IPS template in order to more closely match the concepts of care that we find in our routine clinical systems, for instance, by including both a patient and an encounter level in order to structure the information in a way that more closely resembles the way that it is captured as part of routine clinical care. But it has definitely been an important basis that helped us a lot in getting this off the ground. Thank you.
So moving onwards and upwards up the list, in the GECKO project, a mapping from ICD to SNOMED has already been done. But the question is why not only use the SNOMED, official SNOMED to ICD mapping? Discuss.
So I could take the question. Is an excellent question, actually. For answering it, we have to look under the hood of the German healthcare data system. The point is that until now, in routine documentation, SnomedCT is not documented. So what we have documented is a lot of billing data, and so from the billing data sets from all hospitals, we're actually getting the ICD-10 GM codes. So for now, we got a mixture of data deliverers and data sources, one containing the more administrative data sets. But if you look at EDC systems, so we get SnomedCT terms coming in, I think, starting next year when the license actually is spreading and people are educated. I think it could be a very nice evaluation project to see if the data sets being delivered via ICD-10 GM in the billing data sets is far away or pretty close to the SnomedCT terms. I like the idea, and actually Sylvia Thun is in the conference, so she's the person behind GECKO, and with the incredible power she's coordinating and taking care of the domain experts in order to get a nice data set. And it's all, I think we put the link in there, so you can actually look at it and look at the article models.
Thank you. So just going back to the IPS, the International Patient Summary, can the adapted version of the IPS be accessed somewhere? So is it in the public domain? Or is it still?
Yeah, actually, Actually, we do have a transparent process or governance process for establishing the modules of the core data set in the Medical Informatics Initiative, and it goes through a public balloting period. And the implementation guides for the core data set modules are openly available on Simplifier.
Thank you. So I'm not going to comment on this, although I do know the answer to the question. Are there already plans for a release of a German edition of SNOMED?
I think the question indeed goes to SNOMED International. Ian, maybe you can better answer this question than me.
So at the moment, there aren't plans for a release of the German edition. The MII project, along with 3 other member countries, Austria, Switzerland and Luxembourg, are working together on a joint German translation project. So looking at translations that have already been done and looking at effectively coming up with a global German edition, I suppose you'd call it. Currently, there aren't any plans to release that. Well, there's certainly no dates to release that, so that's work in progress at the moment. But it is something which will be worked on and will appear and be released at a later date. But there are no timescales for that at the moment. So this is one, I guess, for you, Sebastian. Is active participation in the working groups of SNOMED International funded through the MII project?
Yes, this is a difficult question. And indirectly it is, because all of the university hospitals and the coordination office gets human resources funded for the different tasks, including all necessary tasks for working on interoperability. And if there is international work to be done for interoperability, this can be funded by MII. At that moment, we have a problem that we have a shortcoming of experts and human resources, and not of money at the moment. So this is a very difficult question, how to finance more power, more human resources for international working on interoperability in general, and also in SNOMED working groups as well. Maybe it's a very important point for the next funding phase, that we have to talk about delegating experts and financing experts, not only from the institutions which are participating and have funding by the MII at the moment. But at the moment, this is only the indirect way for financing.
Okay, so in addition to the international patient summary, do you also use a common data model such as OMOP?
Yeah, I think I could answer that. So currently the core data set of the Medical Informatics Initiative is purely modeled on FHIR, and it's only on the consortial level within the Medical Informatics Initiative that some of the consortia are actually evaluating or also implementing the OMOP CDM as an additional data model geared more towards actual analytic use of the data. So that is not a standardized way to represent data inside of the Medical Informatics Initiative, but there already exist ETL pathways for converting from the FHIR-based resources of the MII core data set into the OMOP common data model.
Thank you. So I have some questions for you in the absence of any others. What do you see with the MII project as the biggest challenge to getting uptake of SnomedCT?
Who wants to start? may I start? And Uli will add their thoughts about it. I think the basic challenge is that we not only have to define and to deal with the standards, but we have to get data annotated to the standards. And we want to use data from patient care documentation. And I think the challenge is to bring SNOMED codes and SNOMED annotated documentation into the patient care process. This is the real challenge we will have in the next years. And that's not only a thing that the MII could solve, but we have strong partners. And one important point is the cooperation with the KBV, defining the content for the electronic patient record, which will come and which will be executed and certified by the Gematik. So I think we have strong partners working on a vision how documentation should be in the future using SNOMED codes. But this is not a challenge that we can solve within a month and that we cannot solve within the MII alone.
Maybe I add on that, and I would actually look behind the challenges. So of course, the challenge is the information model. The information model has to be adapted and be filled from the data centers. So in every university hospital, there's a medical data center being set up right now, and those people are really great because they have to map the data as it is on the information model. And the industry, hopefully, are picking up those models so that in the future the hospital information systems are already very close to this information model. The chance I see there is awesome because the discovery of data will be much better, and using the better the data is annotated, like with SnomedCT terms, the better I can look at the metadata and search for concepts I need for my research. And then we have standardized ways, to ask if the consent is there for this kind of research project, and standardized ways to ask for the actual access to the data to send the analytics scripts there and get some results back. That's a dimension we didn't have before. So I think it's worth, chewing on those challenges and chewing on the information models in order to get this effect.
Yeah, and maybe to add to that, I think from a terminology perspective, certainly finding a good mapping from our German billing procedure catalog to SnomedCT definitely also is a major challenge. Which certainly is an obstacle right now for international collaborations, also in the context of the OMOP common data model, which would require us to map our procedure codes to SnomedCT, which, however, is it's a challenge. It's a very large catalog, more than 30,000 entries, and that would certainly be an issue that would profit also from collaboration and many hands supporting us in that.
Okay, thank you. I think one last question, unless one sneaks under the wire. Can German vendors start working on interface terminologies and mapping? And if so, how can they access a license to do that? I'm guessing that's to you, Sebastian.
Yeah. The second question is the easier part to answer. At the moment, we have the possibility, as already mentioned in the talk before, to give licenses to cooperation partners, but we are very open to any cooperation also with industry. And we already have given a lot of licenses to industry partners, and I think we showed the number in the slide. The other thing is, the other question is, do they already work about interface terminology, or do they work on implementation in any kind at all? I think this is a difficult question. I think at the moment the research processes we start and we give impulses on from the MII is not the biggest part of business in the healthcare system. I think the industry will follow the guidance which will come in the clinical documentation process and the patient care and also in the billing sector. So I think that the major impulse on implementation will come by the electronic patient record in Germany. And I hope that we will get it managed also in future to work together and keep definitions and specifications in patient care and research close together, then we will benefit from the then starting work in the industry on interface technologies and mapping and implementation and support of SnomedCT and documentation. At the moment, we have no real feedback in industry what exactly they are working with SnomedCT, but we will have a survey at the end of the year, and then I think we will have the first answers to this.
Thank you. And one final question. The billing catalogue that you referred to, so your procedure catalogue, is that localized to Germany, or do other countries use the same catalogue?
Yeah, I can add to that. It's based on ICP-M, but that was many years ago that it was created from that, and I think right now it's really a German-only catalog. And I think it's well structured, but it's very much geared towards billing purposes, and it could be a challenge. It definitely is a challenge to map that to an international version of a terminology.
The difference is much bigger for the procedures than for the diagnosis.
Does the catalogue just include procedure codes, or do you look at procedure codes, grouping procedure codes together for specific purposes?
Yeah, it's a hierarchical catalog, so it does present, I think, a mostly very well-ordered structure, but it doesn't contain, for instance, diagnosis codes, or, as far as I know, no pre-coordinated codes in that sense, even though I think that I should relativate that, but it's a very large catalog, so lots of leaves to look at, lots of structure to include.
Okay. Right, well, we're at time, so I'd like to thank all the presenters again. I think it's been very informative, and I'd like to close this session. So thank you, and thank you, the audience, for participating and for your questions. And hope you have a good what's left of the expo. So thank you.
Thank you.